You doing, guys?
Yes, absolutely. Good evening. We are going to call this meeting to order. City of New Haven Meeting Agenda, Joint Community Development and Health and Human Service Committee. Wednesday, April 15th, 2026, 6 p.m., Board of Alders Chambers. Meeting can be viewed on the Board of Alders YouTube. Board of Alders New Haven notice. The Joint Committee Development / Health and Human Service Committee in person on Wednesday, April 15, 2026 at 6 p.m. in the Board of Alders Chambers, 165 Church Street, New Haven, to hear from the city departments and agencies with hardware proposals concerning the following items, and subsequently meet again at the following software proposals on Wednesday, May 20th at 6 p.m. Deliberations on Thursday, May 28th at 6 p.m. LM-2026-0134, order of the Board of Alders of the City of New Haven approving the City of New Haven's fiscal year 2026-2027 annual action plan statement of activities and use of Community Development Block Grant, CDBG, Home Investment Partnerships, Home, Housing Opportunities for Persons with AIDS, HOPWA, and Emergency Solution Grants, ESG, funds to be submitted to the U.S. Department of Housing and Urban Development for the federal financial assistance for planning and community development activities under the provisions of Title I of the Housing and Community Development Act of 1974, as amended, PL 93-383, the Cranston-Gonzalez National Affordable Housing Act of Assistance Act of 2000, as amended, PL 106-400, the Homeless Emergency Assistance and Rapid Transition to Housing HARP Act of 2009, and the AIDS Housing Opportunity Act, PL 102-550, hereafter referred to as housing, and to be funded by program income and/or reprogramming funds from prior grant years. This item is on file and available for public inspection in the Office of Legislative Services, 165 Church Street, New Haven, for order. Honorable Carmen Rodriguez and Honorable Campton Singh, co-chair. Attest, Honorable Michael Smart, City Clerk. If you need an accessibility-related accommodation, please contact 203-946-7651 voice or 203-946-8582 TTY. In accordance with the City of New Haven COVID-19 guidelines, masks are now optional. Public may send comments or testimony via email to publictestimony@newhavencity.gov before 2 p.m. on the day of the meeting. At this time, I'd ask that all my colleagues, starting from the right, introduce themselves.
Frank Redecki, Ward 15.
Active in Town, Ward 16.
Christine Kim, Ward 7.
Frank Douglas, Ward 2, Community Development.
Carmen Rodriguez, Ward 6, Community Development.
Captain Singh, Ward 5, Health and Human Service.
Sarah Miller, Health and Human Service, Ward 14. Mandy Martinelli, Ward 8, I'm on full committee.
Lisa Morant, Ward 12, Health and Human Services.
And I want to acknowledge that Walter Wingate from Ward 29 is here with us this evening. I'm going to ask that my colleagues, if you can move your microphones closer to you guys when you are speaking. The other housekeeping rules, if anyone has a phone this evening, we are going to ask that you put it on silent. If you need to take a phone call, there's a lot of people here and we want to pay close attention to everyone and be respectful so that we can hear everyone's testimony. Again, if you need to take a call, please definitely go out into the hallway so that when we have our folks come and present the item, everyone can hear. Again, we thank you all for being here, and we are going to get started with our and as you all come up and everybody else, they do have to present please your name and address for the record. Thank you.
Hello, everyone.
Hello.
Another year. I see we have some new faces. So we are here to talk about the consolidated plan budget process. So you should have all the documents in front of you. We have a presentation that we're going to start off with. And go through this book. And then the last thing we'll do is I will talk about the 4 or 6 admin that we have, so I'll testify on that. I know on the, it's 1819,
Allison Harrington, Camden, Connecticut.
Cameron McDonald, New Haven, Connecticut.
Okay. Thank you. All right, so we have this presentation we'll go over. There's a lot of information in here. There's also a lot of information in this book that we have. And we're here for questions. As you know, we're always here to help.
Guide us and give us the page that you're on.
Yep.
Topic.
One thing I wanted to mention tonight, city departments were supposed to testify tonight. There are a lot of people away on spring break, so we were hoping that they can testify on the 20th. Okay, just to clear that up. But I will talk about the admin. I can verify our nonprofits. That's on my list right now. Okay. All right. So I will let Allison start the presentation.
All right, so just an overview of the consolidated plan. It was created in 1995. It was combined with CDBG, ESG Home and Hopper grants. It requires a 5-year plan to help the city assist or assess their affordable housing and community development needs. The consolidated plan process serves as a framework for to identify housing and non-housing development needs and priorities. Each 5-year plan, submission of yearly and annual action plans are required. The annual action plan is used to address the yearly priorities and specific goals by the city. Accomplishments are supposed to be reported through each year, i.e. solid and annual action plan. The keeper report for accomplishments on completed activities as well as the progress of open activities, and the city's entering the 2nd year of our 5-year plan, which covers July 1, 2025 to June 30th, 2023, or 2020.
2030 seems like a long way off.
Right around the corner.
Yes. Yeah, we'll go through the first section of the presentation. Get some of the information here, but Alicia, what we're talking about.
Okay, so overview of the annual action plan and how much money is going to spend, when does the money go for. So the annual action plan for housing and community development is the city's annual plan for addressing housing and non-housing and community development needs with federal funding. The grants are designed to benefit low and moderate income persons and individuals with special needs. The city prepares and submits its most recent 5-year plan in 2025. It covers fiscal year 2025-26 through 2029, 2030. Annual action plan is under the 5 years. The consolidated plan process serves as a framework to identify housing and non-housing community development needs and priorities. So each year, the city is required to prepare and submit annual action plans to HUD. The annual action plan is used to address the priorities and specific goals that identified by the city. Accomplishments are submitted to HUD through the keeper, and that's the consolidated annual performance and evaluation report. And the CAPER report accomplishment is completed on activities as well as open activities. We also then have our 5-year. So our 5-year must be by August 16th. There is no exception as this is congressional statute. Is in year 2 of the plan. So then 5-year goals are going to be, as you see in all of them, just a couple of to be preserved and improve existing housing, stabilize neighborhoods, improve access to home ownership, as well as to provide administrative support for community development or community activities. Okay. So the keeper is what we will need to do year end. The keeper report annual financial and programmatic accomplishments to HUD. The keeper must submit before the end of September, and then the process begins for us to start the process. So it's going to be November, December, have the webinar in December, and applications mid-December, and applications in January. So the city receives 4 entitlement grants through HUD. So it's going to be CG, ESG, Home, and Hopwood. Over a 5-year period, this amounts to around $35 million. So then it's going to be housing, and it comes down to us, and then it goes to nonprofits.
Okay, so I'll talk about some of the funding that we have, and we do have our final allocations. We did get those in, so total that's going to be on slide 12. So just over $5.8 million. And again, about $35 million over a 5-year period. So we have we just did our 5-year plan. So those goals, those are going to be for the full 5 years, which everyone approved. On slide 14, now this is the anticipated allocations that we're using for the mayor's recommendations. So you can see the percentages here. We were estimating, I was rounding down from what we had, so we just rounded up numbers. They did come in, most of them came in close to what we had, except for Hopwood. We estimated about 1.2 million. We had, for current year, we had 1.27 million. So we're estimating about 1.2. That allocation came in at only 943,000. So we have to reduce that allocation by about 256,000. So that was not part of the mayor's recommendation. He was basing his numbers on 1.2, so the committee will have to reduce that by the 256 million. And we'll work with that as well. CG was slightly less, only about $2,800. Home, we had an increase of 48,000. ESG had an increase also of 1,800. So Paco is the most serious. Okay, then on slide 16, we do have contingency clauses. Just in case we're involved in many lawsuits. So I think we have 5 right now that are active, that are being appealed. So this is a contingency clause, this will be included in the order as well. And then we spoke about this earlier, what activities are being funded. So we fund soup kitchen, we can fund the Girls Club, public improvements are done through this. We have a grocery delivery, there's homeless shelters, homeless house, and various city departments as well. So we have staff in LCI, we have some staff in the Housing Administration and Development Department, we have staff in EDA, we have some staff in my office, management in Office of House Management Grants, CSA, and we're in county as well. Okay, so the grant application process. We're receiving grants, we're receiving funding applications from nonprofit agencies. It's a sense of checklist that we go through. We want to make sure that everyone has capacity. Projects are great, nonprofits do a great job. Sometimes the administrative capacity is not there, so we will help as much as we can. But there are reporting requirements, especially on tax returns, making sure your payroll taxes are paid, things like that. So we do check all of that information. Okay, so Cameron will talk about some of the eligible activities with this fund.
Yes, so I'm just gonna give like a quick overview of the different categories that are eligible under the 4 grant categories. You can also refer to this as we go through the different proposed budgets and such. But for CDBG, they mainly focus on property, code enforcement, economic development activities, home ownership assistance, planning and capacity building for city government. And then there's also program administration costs. The city utilizes programs to also utilize for indirect costs as well. There's also for ESG, this focuses on supporting things like case management, operations or logistical costs, shelters, administration costs. The administrative cost cap was up to 7.5%, which is lower than G. This can also be used to help for office space rental, emergency shelters, support services, homelessness prevention, and rapid rehousing, as well as street outreach. BoA has some of the most restrictive eligible categories, and this includes housing development and construction. The administrative costs is up to 10%. These can also include downstream assistance and residential rehab. And then HOPWA can include activities such as case management. We also have a restrictive administrative cost of our percent of 7.5. It's also include office space rentals, support services, street outreach. And then there's tenant-based rental assistance, short-term rental, utility allowance, and then permanent housing placement. And after this, the proposals must meet one of 3 national objectives. So they have to benefit low or moderate income persons or households. They have to focus on the elimination of slums and poverty, or focus on urgent health services, which is the most rarely used category. And nonprofit agencies and city departments must be able to demonstrate beneficiaries. Individual activities must benefit 51% low moderate income persons and no less than 70% all overall funding during the 3-year certification period has to also go for low moderate income people. And then slide number 24 provides an overview of the funding caps. For CDBG, it's a 15% max for service, and then for planning and admin, it's a 20% max. Hardware has funding cap. Profits, reprogramming. But then ESG has, like I said before, 5.7% max for admin, shelter 60%, region 40, home has 13% admin cap. The CODO, CODO has 15% minimum, and then housing development 85%. And then Buffalo has planning admin cap of 3% with unmet funding cap on the
So on the home energy, the community housing development organization. And right now, we only have one. Only one was a housing, community housing development organization. BoA?
Excuse me,
Yeah.
thank you.
Yeah, there's certain rules that they have to follow in order to get that. And that's housing department now, they're working closely with the agencies to try to obtain that status. Because that is a percent minimum, we have to fund new construction at 50%. One of the things I wanted to go back to that's important, slide 23, is here where we're saying measurable outcomes in beneficiaries. So that's why we're scrutinizing all the applications to make sure that agencies have that ability. We have to report it. If we don't report accomplishments to HUD, they consider it not a completed activity, and we would have to reimburse that. It would most likely come from the city. We're not going to ask a small nonprofit repay funding. Okay, so now we're on slide 25, and these are amendments. So for the committee, so there are certain rules that apply to amendments, and I don't have to go through every single one, but we can, if there's questions, let us know. It's a little bit complicated, like for public service activities, you can only revise a public service within that category. Same thing with admin. Admin is only within that category. So you can't say, okay, I want to move this funding from hardware to public service, and then we would exceed the cap. You could go the other way. You could say, okay, I want to take this public service money and move it to hardware. That's fine. Or admin to hardware. That's also fine. Not the other way around because of the caps. But if you have questions, we'll help you through that process. And then just that last slide, there is public participation, public comment periods. So everything is out on the website right now. It was submitted to the full board. I think it was April 6th, I believe. So that April 7th, we published for public comments, 30-day public comment period. So we do have.
You can also find the 5-year consolidated action plan document on the website, which lays out the goals. And then also highlighted is if you go to our kind of webpage on the city website, you can find all of the previous consolidated annual action plans, which show the funding levels from last year, the programs that.
Okay, so that's the first part. So we can take some questions now on this.
Any questions at this time?
So just a clarification. So we need people understand the process of
Yeah.
how we're moving.
Yeah.
From hardware.
Yep. You see, for
Through the chair, we'll work that out.
Absolutely, absolutely, that's a great plan.
yeah, and we do have a lot of time before the May 20th. So
Thank you, Madam.
Thank you, Madam Chair. Thank you, Madam Chair. I had a question about the timeline of the Buffalo reconciliation. So when would we know that allocation would be changed?
that we did get notification from HUD. We got our award letter, I think last week, that is the amount. So that
That's it, okay.
943,000 is the amount. We were anticipating 1.2, So I was very surprised at that. So the director, the community planning development director, and discussed level funding, maybe just rounding down where we with that. So unfortunately, that came much less than we were hoping for.
Thank you.
You're welcome.
Any other questions from committee members? Okay, so we definitely will get something in place, so we'll connect and then we'll
Yes.
reach out to committee members. Thank you, all three of you for presenting and being here once again this year. Thank you, appreciate your time.
So now this, we'll go through this, yeah, we're gonna go through the book, we're not gonna spend a lot of time on everything.
So it's just gonna be on page one, it's gonna be our timeline of what we're publishing. It's gonna be then page two of what we sent out to the agencies in terms of the application process, et cetera.
If we could just go back to page one for a minute, there's just three important dates that we wanted to look at for that time. So May 25th, that will be committee member amendments submitted to the chairs. So that's on May 25th. And then usually the co-chairs would meet, we would meet with the chairs, go over that. That'll be on May 26th, and then deliberation is on May 28th. So just to highlight those important dates, and that's what the dates that we discussed with Alder Rodriguez and Alder Singh. Okay.
All right, so then it's just, again, going to be the emails that we have in terms of contact information. We have the public meeting, so this is just going to be the contact information. This is our whole webinar.
Presentation.
Correct. That Cam was very nice to present. And then on page 50, it's kind of what we're requesting, for, all of that. So it helps with like trying to figure out where they're looking and how much they're looking for.
So that'll be the reference for the page numbers. So agents and agents are on page 72, so that everything is in order. We can go through those pages.
And then on page 62, it's going to be the consolidated plan funding. It's going to be what we're looking at for 2026, 2027.
So this one, we do have the actual numbers on here of what was compared to what mayor's recommendations were anticipated to what was actually approved. So you can see those differences here, you can see the differences by the categories. So under CDBG, and what we did with CDBG, we had extra reprogram. So we're going to end up. Okay, so you can see we have $40,000 extra in the program. It was an activity that wasn't moving, and this was after the proposed recommendations. So we are going to increase by that $40,000. And then public service, it's only a $426 reduction. You can see that in the category. And then the admin is only a $568 reduction. And then when we go down to home was increased, Howard, that's the biggest one, $256,000. But we did have $30,000 programming there. So the net change to HAPA will be a $226 decrease. And again, that's what we work with chairs to address that. And then the next page is the reprogramming, that's the list. So we have mayors, the first column, and then the revised, the second column. So you can see we added $40,000. We added $10,000 for ESG, and then another for.
So then the next couple of pages is going to be exactly what people applied for and what was recommended by the departments and explanation. So that's until page 29. Yep. Yep. And then we also put through what are the total applications, the funded, the non-funded, on page 89. To kind of give you a synopsis of like where we were at with submission. It was a little bit smaller.
Yeah, less applications.
Yeah.
For some reason, we're not sure why. State outreach, everything was the same. We had the oral news was different than last year, but it was much easier. It was much more user friendly.
Yeah.
We're not sure why there was such a difference. The same timing, so the agency knew it at that time. So we're not sure why there was such a difference.
Correct. And then the new applicants is just going to outline a couple of new applicants. Again, versus last year. And then we go into the new applicants. Which
Yeah, and there were some, couple agencies that were partner agencies. They weren't on the notification list, so they will be able to testify on the 20th as well. It might be a little bit longer on the 20th, a little bit more.
And then we have our 5 goals, which is going to take us to page 96, and then go through exactly where area of service, essentially. So this is going to help in terms of what they requested and how they're going to spend their money and where.
So with the service areas, that is part of the Cape, HUD does ask for service areas. Most of the areas are citywide. Some of them are a little bit more specific by neighborhood. That's the book. So we can take questions on that now.
It's a lot of information.
Yeah, there's a lot of information there, so.
Thank you.
Any? Alder Miller, sorry about that.
Thank you, Madam Chair. Thank you for the presentation. Good to see you again.
You too.
The chart on page 53 through 56, my eyes are pretty good.
Oh,
Oh, yeah.
What
That's-
is that?
Thank you.
Take that one out.
So that is our completeness checklist. So we make sure that everything that needs to be submitted
Yeah.
is actually submitted. So there's going to be, there's certificate of insurance, their disclosure, their summary of what they're actually going to do. So my apologies, it's
Smaller
Okay, through you, Madam Chair, maybe we could just get an email copy that's
Of
legible,
course.
just for our
Yeah.
due diligence. And then my other question is about the programming, and I just may not be remembering from last year, but like, why is, I mean, I know this is the mayor, what was actually given, but why do we have this much recruitment in the first place, and how are the allocations? Some of these agencies are also getting funds through the regular process. So
Yes.
how does that, why do you have in the first place, and how does the process work?
Okay, so anything that's a public service, if a public service agency did not spend their money by the end of the year, that's automatically revoked. You can't use that for the following year. For public service, we can use it for hardware. That caps come into play. Other departments, there were some lapsed salaries for the CSA admin. That was one full position with benefits. They did not hire a person, and that's admin funding. Admin funding cannot be carried over into again the following year for hardware. So all the reprogramming needs hardware. We had in OPMG another larger amount. There was, we had a vacancy there as well. We weren't sure if we were actually going to get funded next year. So positions were vacant. We didn't want to hire somebody for a year and then have to lay them off. That's why we see some of the big amounts. And then the same thing for the HUD regulatory compliance line, 90,000. Same thing. There was a person there who was doing the compliance, and she's doing the environmental reviews, environmental checklists, and historic with the State Historic Preservation Office. That's one of the regulatory requirements. She moved from CDBG to general fund, and she was continuing doing that, which is necessary, but same thing. You want to have to hire somebody, train that, and then have to lay them off at the end of the year. Those are the bigger balances. Some of the other ones, most of the other smaller amounts were public service activities that did not move. Some of the other larger amounts, those were some public improvements that they were not getting off the ground either. So we gave them a couple years to work on it. So that also gets reprogrammed.
Absolutely.
So, for example, there are some right for 50, 40, 30. Are those awards that we made last year and they just didn't get spent, or they're like were they tied to these agencies last year and they're still with them? Or?
So it was. I don't think there was nothing that was last year. It was probably the year before. We were giving them a little time to try to get everything together. We've been getting the applications much later than typically we have. Usually, our January in the past we have. Now, getting this in April was fairly soon. Normal. Some of the other allocations came in very late, so it just took much longer for agencies to get their contracts executed. So it was probably 2 years ago, but we can get that more detailed.
Well, it was that, but these were dollars that were previously allocated to these specific agencies.
Yes, through this process, through the mayor's recommendations and board level approval, yes, everything was allocated at some point. Last year, the year before, some.
Okay, thanks a lot. That's helpful. Thank you.
So this was the funding. Now my question to follow up on, so they did not spend or were not able to spend.
Yes, did not spend it, were not able to spend it. Something happened, project fell through. Some of them could have been, it might have been more once they started working on it, looking at it. It might not have been feasible anymore. Some of the other things too, what happens is some agencies, they get other federal grants that got earmarks from Laura's office. So for instance, like for Boys and Girls Club, we'll just use them. They got an earmark. If they were using CDBG funding for that earmark, then there's other requirements that kick in, like there's prevailing wage requirements. So it's not worth it to give them $50,000 of CDBG funding when prevailing wages apply to the whole project, just below the project right out of the water. So something like that, it's better not to fund them with CDBG. Because we just add so much more to the project than just $50,000.
Okay, thank you. Any other questions from committee members? Oh, I just. Alderman Martinelli, and then we'll go to Alderman Fowler.
We're going to be on 63.
Cool.
Thank you.
Yeah, okay, so my question is a follow-up to, I have two questions, if that's okay.
That's okay.
A follow-up to what we're distributing funds. Is that your normal practice? It's only going to be a year for the employee, you're not going to hire for that? Is that normal practice if you don't want to train them?
No, it's not.
No, okay.
No, we've been, I think this is the 51st year of funding now so we've been getting this for over 50 years.
Okay.
This is the first time that we're really in danger of not receiving this funding. That was the uncertainty why we didn't want to hire somebody at that point.
In the budget for Congress.
I'm gonna have you use your thing.
In one of the draft budgets that were produced to Congress, the entire program had been cut totally. And so just the amount of funding that we were going was really up in the air.
Thank you. Thank you for that clarification. And now I'm going to skip budget
And
89.
before you move ahead, I don't believe it wasn't that they didn't want to train, was the concern that the money was up in the air and not offer someone a job that wasn't going to be
Exactly,
there.
yes.
Okay, I just wanted to be clear on that.
Yeah, so not so much the training, but to go through all that, or it's a lot to train.
Yes.
It's a lot to train somebody, and it's a lot of these things, it's once a year, so it's a cycle. So you can say, oh, wow, you've been with this for a year, you've been working on this. That's not how it is. It's like, you've been here a year, you did this one hour. Yeah.
Okay. And my other
So
is on 96. So we have the amount requested in the mayor's proposed. And this might not be for the committee, and I'm just learning, I'm brand new, and I'm just trying to figure this out. It seems like some of them have TBDs, under the proposed unit and accomplishment types, but they got funded. Like, how is that determined? Is it just sitting there and then, I guess, because to me, it doesn't look like we know what it's gonna go to if it's TBD. So that's kind of like, so is there more backup to what the proposed units are, and could we read more on that? Is that in this book?
It's not, we did not have that information at the time we published.
Okay.
But when the city departments come in on the 20th, so that is a city department, the economic development, yeah, they're all city departments. So you can ask at May 20th hearing, yes. Make sure they have that information.
Yes, that would be great. But actually, I'm sorry, then the 200, let's say the officers of economic development, 250 people, 100 businesses, where would we find what they're gonna do with that? Is that all we have to know what they're gonna do with the funding?
So typically, people will apply for, I want $100,000, I want to help 250 people. And realistically, okay, we give you 30,000, how can you help people? So we will adjust upward, and we will send that to you guys as well. Because again, you can't say that, okay, you're going to serve the same people that you were planning to 100,000 with only 25,000. So we send it to you as well.
So what we'll do is, like Allison said, the agencies will submit a $100,000 request. They may get 25, depending on what's by the board holders. We'll send out an updated performance indicator. So we'll say, requested $100,000 and you're going to serve 100 people. Now you're only getting 25,000. How many people are going to serve? What's going to be your goal with 25,000? Because your goal is not going to be the same 100. We don't want to report because we report the goals also. That's part of this. Basically, it's an application to HUD. So that's part of that application is putting in the goals. So we don't want to inflate the goals and then not fund somebody. We can't expect them to meet that goal when they're requesting 100 and only getting funded for less than half.
So do we see the grant application as well then?
You could if you want.
Okay.
You could if you want to request it. Have it.
The easiest way to do it is if you look like it starts on page 64, the description is the description of the project.
Oh, great.
So that's like the summary put together for what the fund can be used for, and like ostensibly what the grant program is hoping to accomplish.
Wonderful. Thank you so much. That's very good.
And we do have like a couple applications retaining, so if you want more details, I can give that to you. But this is like a summary.
Great, thank you. Thank you, Madam Chair.
And any other questions from committee members? Any questions? That was just, okay, thank you. I know that when Alderson and I met with you all, we did ask, and this is for a lot of folks that are more on the committees. We have requested to hear, for those who are asking for CDBG funds, have requested that we want to know what awards they've received, if they were awarded more funding. And I know that you guys are working on that information. That is going to be shared with all the committee members here so that then we can make an actual good decision that if someone was awarded $1 million, we're going to work with this team to know how we look at this funding and if that individual has funding. So that's what I requested when we met. As soon as we get that,
So we do have some of that information already. Yeah, we don't have everything, that's why we didn't.
That's okay.
Bring it in, because we didn't have everything.
I appreciate you saying that, and I wanted to let my colleagues know that's something that we want to do so we can make the best review things and in the best interest of all the folks that are wanting to do something good that we want to share amongst everyone.
Yep.
As a million, then we'll work together as this team to ensure that everybody.
Yeah. Then on page 64, starting on page 64, there is a column for leverage funding, but that's related to only this request. So we don't like to fully fund the project. We don't want somebody to come in and say, you know, $1 million project, we want all this. So try to use this to supplement, to leverage other funding, not fund the project.
Any other questions from committee members?
Okay.
Thank you.
So the last thing I will do now.
Yes, sir.
These are the admin applications that we have. So we have 3 CDBG admin requests, and that is, part of it is in finance, part of that is in community services, and 1 position in city planning, and that's that regulatory position. The ESG positions that's partially funded through a position that's in CSA, and then the home admin, that is also a person in housing administration and development department. So basically, it's covering salaries. We do have a consultant that we're paying on this grant, and we have another HMIS consultant who we're also paying the track all the homeless guys. So everything that's on this list, if I can go through every single item if you want, but this is what this is funding. So we're funding personnel. We are, well, entry elements. We're processing invoices. So we're paying out of this funding to process invoices, POs, execution of contracts, RFPs. We're processing drawdown requests. There's an online system, it's called IDIS, Integrated Disbursement Information System. So that's what everything gets reported to HUD. We're drawing down, so each individual project, they have their own IDIS system. So if there's a $20,000 amount for 165 Church Street, we're showing that $20,000. We're putting in a column in that $20,000. We're putting in accomplishment data for that $20,000. The race, ethnicity, income levels. So it's a lot of information that all gets generated into the case, which is also, it's also a lot. And just preparation of the HUD doc 5-year plan. The 5-year plan was all about citizen participation, very, very big part of this process. What else do we have here? Printing these books. It comes up to a lot. And if we didn't have these admin funds available, we wouldn't be able to run the program. There's no way we could run the program.
The paper one.
Yeah.
Like specifically the reporting that the government requires is a lot of time and a lot of data, and so they're very vital to the process.
I'm sorry.
It's a lot of work. It's a lot of work, but
We help people, and that's all we care about.
yeah, that's what we always say. We've helped hundreds of thousands of people with this funding, and you have to. And
And we
we
appreciate
have
it.
a great team, and we work.
We
So
appreciate
we
that. And we
appreciate
know that behind the
Allison, we
scenes, and
appreciate Cameron very much.
well, I can say, for doing this several years, I can say I appreciate you all. Yes, Ron absolutely has been focused, but it's all for the good of folks, like Alden Miller said, it's hard work, yes.
Yes.
But getting across the finish line is what we're going to do, so appropriately. And the best that we're making is to make a appropriate decision. Everyone that's what we're here for as well. So, and if any owners decide that we have, we can meet with this team, then we can definitely come together and meet with them. I know we have more conversations. So, we thank you guys.
Lisa, you do.
Thank you, Ron. Thank you.
Thank you
very
all.
much.
Thank you all for your presentation this evening.
Always.
Yes.
You'll be seen.
Thank you all. So we're going to ask that our next presenter comes up. It's Bishop Harmon D. Malati, Faith Revival Temple Church. Page 65.
You come right up here.
Yes, come right up here. Sorry about that. Okay. Page 65. Page 65.
Come on here, sir. Take a seat.
Good evening.
Good evening. I'm here with three persons.
They are more than welcome to join you at the table.
Representing several of our church.
Yes.
Please come.
Yeah, yeah.
65.
We'll have you all sit, get comfortable, catch your breath.
Yes.
No worries. And it's
But the person,
Just
if
no.
anybody wants to stay in the back.
no problem. So just catch your breath, and when you're ready, just your name and address for the record, so that we can hear you and folks in the audience can hear you as well. You can pull the next beat. So your name and address for the record, and begin when you'd like.
My name is Harmon Yolate in Faith Revival Temple Church.
My name is Kanisha Robinson. I'm at 1500 Elmhurst Boulevard in New Haven.
It's William Wilson, Faith Revival Temple Church, and the church is at 2 Elizabeth Street, West State.
I want to say one or two things and I will rather than talk. Faith Revival Temple Church, I've been in New Haven for a long time. Just a brief history and the work that we do. I first came to this country, one of my first places I had a minister on the church place up. And then to Ferraro, 7th Avenue, Congress Avenue, and then SC Coffee, I think they changed the name, but on Chapel Street, they had a place there where people with HIV is, what to meet with them, and we served them for some years with whatever little they were getting. So basically, uh, whatever we have, from outside and the church, use that to reach out to people in the street. I used to start being a street preacher. I would preach in the street, and then would go and hand out tracts and let them to people all over the city. But I don't want to bog you down with that. I got a copy of our news that I will try to leave a copy with you over the years, what we have been doing. So besides the SC copy that I talked about, we were receiving pictures from a supermarket, I won't call the names in here. So we receive it, and then we carry a distribution. We Columbus Avenue, served them for many years, and then also what's the name now? This Davenport, but we have a place on 7th Avenue where they could be there. We take the pastry there to them twice a week, and then yes, and then the place where Ferrara has been, there's a shelter there, and we also served them for many years. The group that was helping us, they changed, so we haven't been able to do that, but that didn't stop us. We still, whatever people in the congregation they gave us, we, we use that to serve people, meet their needs, package and serve them. So,
Again, my name is Kanisha Robinson, and I am in support of Faithful Bible Temple Church. I met Bishop Yortai about 35 years ago, knocking doors in Church Street South, which is where I'm from. And I have watched him over more than 3 decades, almost 4, serve our community in ways that is overwhelming emotionally. We were one of the families in Church Street South. We were family happened to be poorer than most. And this bishop has on our table. And those are the kinds of things that you just don't get. So when it's time to stand up and speak about the things that he's done for the community, I was one of the first people that wanted to be here. I have also watched him serve in other capacities. He's also served, I think he's probably thought but I watched him serve at Columbus House. He's also helped out with the emergency family shelter, the CAA, and other places there were emergency shelters and management services, AIDS Interfaith, Forest Hills Guest House, another place that he served, or they served. And I do also remember as a young teenager, Bishop also went to the right across the street from the railroad station. And it was a particular donut shop inside there that he went over and said, please do not throw this away. I will take it and I will give it to the Columbus House. And I remember being on task a few times, taking those bags of croissants and donuts and bagels right over to the Columbus House, which is also in our area. And so, in many other capacities, this should come from Africa with a 2-year-old. Unfortunately, had just lost his wife and baby's mother. And just to watch him do that kind of work with a 2-year-old it was heart-wrenching and also overwhelmed emotionally. And I just want to watch him carry out the work that he's done over almost 4 years. I am in support of it. I just wanted to say my piece on that, and I am a New Haven taxpayer. I don't speak for everyone, but I can say that my tax dollars, I feel like would be well spent in a grant. Not grants are great, but if it was my tax dollars, I could give it to him. My tax dollars would be well spent in a grant or funding for this cause. And yeah,
ShopRite was the one who was supplying.
ShopRite also supplied baked goods as well, that he would go around and donate to other shelters.
So again, my name is Toya Wilson. I've been a bishop for pretty much all my life. And he had been an humanitarian, always willing to help, I remember one time he had a church open for the homeless to come there and take showers, and I think that's still happening. He always at your door, even if he knows you have it, he will still come, with his basket of bread or something, try to reach out. So his main focus is to reach out there, help people, inspire people, also bring people to Christ. That was his focus. Um, we have a lot of activities in the church that we ourselves, try in our week way with Bishop Fund. So if we could get an assistant, you guys, a friend or whatever to help the church, we really appreciate it because he's trying hard, he's seeing how hard he's worked, and how he has helped. He currently even goes to a group home and will bring, every morning, for Sunday morning, he offers bring them to church and drop them, back home, offer them food in the morning to church. So in the morning there's coffee, there's donuts, and everything at the church. So he's been doing a really great job, and we want to see that, move forward.
And if I just also quickly mention, one of the goals that we're trying to help meet, provide have a warming center in the building for the homeless. Um, Probably won't be in this season, but that is one of the goals. There's space for it, but it's just, that there would be funding to help that be accomplished. Because Bishop has always, opened up his homeless, but and lots of times with very little. And it would be nice to see him be able to spread it a little bit further for more people because there are lots of people in the community to help. Such I think something that will really benefit the people, keeping them out of the cold in the winter time. And I don't know if you was a little bit more to that, but
Well, we have, God bless us with a space. We have a big space there to be able to do a lot of that. And so we know this winter is on over. So we preparing and praying that by the time the next, winter season comes, be able to one of them that we would be able to actually taking people. We were expecting something one time that didn't come true, but we took one or two person in, they slept overnight and we took care of that. There have been a few times where we, have paid for people to go in the hotel. All of that. So uh, that's nothing I can say, but we've been working in the city for many, many years.
So I want to thank you for all the work that you do for the community. I'm just a little concerned about you're located in West Haven.
Yes,
I know there's trying times, but you were in New Haven.
yes.
What forced you to New Haven, to West Haven?
Yeah, okay. Very interesting. And minister started in New Haven. We wanted to always be in New Haven. We started at YMCA. My major outreach point was Church Street South. We were on 7th Avenue for 150 years. So we were looking for space and we couldn't get anything in the city. So in West Haven, we found something, but it didn't stop us from reaching up because majority of the members in the congregation from New Haven and the ministry started in New Haven. So even though we're in West Haven, we're still working in New Haven.
That's what I want to do. I want
And
to hear.
it's just.
Thank you. Thank you for all the work that you're doing. Thank you for the support.
So we thank you, although you're a few steps away, you are still addressing the needs in the Haven community. And that's very admirable of you. So we really thank you for what you do.
Thank you.
All of you.
Thank you.
Thank you so much. Thank you all for coming.
Thank you. Yes, please. Thank you, sir.
Thank you.
Thank you.
Our next is from Continuum of Care. Deborah, come on over.
My name is Deborah Cox from Continuum of Care, which is located at 109 Legion Avenue in Haven. I'm here to speak up. First of all, thank you very much. This is a lot of work for you, I can see that. It's a lot of work for us. So Continuum of Care, for some of you who may not know too much about, 60 years, celebrating your 60th anniversary. We're here in Haven, have 60 properties around Connecticut, more than half of which are in New Haven. So we have real strong roots here, and I'm here to talk about the first application. Sorry. Our mission is to serve individuals who, adults who have mental illness or substance use conditions, homelessness, as well as some individuals who have disabilities. The two grants that we submitted were for individuals with mental health issues. We serve more than 3,000 a year. And we do that by providing housing, supportive services, clinician care, case management, and so on. The first facility Terrace is an apartment complex that's used for community support for adults with mental illness. And I should all start at age 18 and they go up to the 80s. You see an aging population. These individuals here have experienced chronic homelessness or long-term institutionalization, and they've come a long way to being able to fairly independently with support services that we provide. For many, the Sheldon Terrace is their first experience in permanent housing, and having this level of stability and security. This permanent supportive housing program is staffed on premises by people who clinicians and peer support and case managers, providing in-home case management, Mental health therapy, hands-on skill building, some of these people, especially if they've been homeless or institutionalized, have lost their skills and how to live in the community. Budgeting, medication management, daily life skills, we help with all of that. And the staff also assists with treatment coordination, transportation, health and nutrition guidance, connection to community resources. The program promotes overall wellness through structured activities, social and recreational opportunities that help reduce isolation that people with mental health so often find themselves in. And we provide ongoing services that strengthen community integration and long-term stability. There are 20 people who live in this facility. In this, it's an apartment complex. Yes. As you can see, it's spread out. It has a nice little community feel. Each apartment, there are 10 apartments. Each apartment has 2 people living in it. It's helpful for socialization and learning. So the work to be performed is to replace all the, it costs about $100,000, as you can imagine. We are asking for $75,000. We will fund the rest of it. It requires a whole room replacement. It's extremely old and it's had experienced repeated leaks that have been patched multiple times. And it's most definitely exceeded the life expectancy. It's no longer truly structurally sound. Continued deterioration places residents at risk for water damage, mold, which is very dangerous, and unsafe living conditions that can negatively impact both physical and mental health. So replacing the roof and insulation will provide a safer, healthier, and more stable living environment for the residents who manage very complex mental health and substance use challenges. All individuals live below poverty level, and so themselves are qualified. I'll stop there if you have questions regarding that request or what I'm saying. Any questions from any members regarding the request?
No question, but just, once again, to thank you for all the work you all do for the community. Continuum care is very important because I know the services that it provides for a lot of people, and they're very appreciative of it.
I really appreciate that, and I will take that message back. We feel that the city has been a great partner as well. Without that partnership, a lot of our residents would not be served in the way they're served today. So thank you so much.
Thank you.
There was also a second request.
Go ahead.
No, that's okay. I don't believe it was recommended to go forward, but I'm going to just talk about it anyway, just so that you have the background. It's called a common bond. It's on 517 Gordon Parkway. Clients for this program are referred to us by Connecticut Department of Mental Health and Addiction Services. The program provides community-based transitional housing for individuals with mental health issues who are exiting long-term hospitalization or in state forensic hospital or incarceration, just coming out. So they need the care and services as they learn to become part of the community again. And they need to get connected to the right services so that they can become more stable and live on their own eventually or with proper supportive services. A common bond offers psychosocial peer support and assistance with the challenge of social reintegration, which is very important. So we provide transportation, all clinical care, and legal and medical counseling. There are 10 residents in this facility, and again, all of them living below the federal line, well below. They stay approximately 6 months to get acclimated and get the services connected to the service they need, and then they move on. So within a given year, approximately 20 people are served in that house. So the purpose of the grant or the request is to do siding and insulation. This picture is does not do the disrepair justice. When you drive up to that house, you immediately notice the peeling and the damage on the paint. So, we did over and over again, it just doesn't do it justice. The request is really for $40,000 or $50,000. It's a paint job. I really appreciate you listening. Thank you. And all that you do, we do appreciate it. Thank you so much.
Thank you. Appreciate you.
Thank you.
Yep, I'm gonna wait. Our next presenter is Janice Freeman. Janet. Children in Placement, sorry.
Page 4.
What page?
Hi, good evening. Your address for the record, please?
My name is Janet Fryman. I live in Middletown and work in New Haven. So good evening, members of the board and staff. I'm here on behalf of Children in Placement, a nonprofit that has served Connecticut's most vulnerable children for 47 years. Each year, 15,000 cases of child abuse and neglect from children in Connecticut. These children enter the child welfare system through no fault of their own, often facing poverty, trauma, and instability that left unaddressed follow them into adulthood. Children in Placement is the only independent agency in the state authorized by statute to train volunteer guardians at home for the probate and superior courts. RGALs are thoroughly vetted, background checked, and complete a rigorous 40-hour training program. Unlike attorneys and social workers manage dozens of cases, our advocates focus on just one or two children at a time, ensuring that every child receives dedicated, individualized care. The results speak for themselves. 90% of the children served by CIP achieve placement in a safe and permanent home. Studies confirm that children with the GAL receive court services faster and reach permanency more quickly. We requested $25,000 in CDBG funding to support recruitment, training, and management of volunteer advocates serving Native children. The past 5 years, program years, CIP has served 166 and 283 New Haven area children annually through this program. Children in our community deserve a voice in court. Your investment in children in placement ensures the outcome.
Any questions from any committee members?
And so, how long have you been in existence?
47 years.
47 years.
Mm-hmm. Yeah, I know. And hopefully, one day that there won't be, we won't exist because there won't be any children that are abused and neglected.
Well, they're saying.
Mine just annually.
Annually, about 700 statewide.
Alder Dente.
Thank you, Madam Chair. Do you provide the guardian ad litem for all of the court cases?
Yes.
In New Haven?
Mm-hmm.
So I have to personally thank you because as a single father who received custody of his child at 11 months old due to abuse, I would not have gotten custody without my guardian, Tony Karajanis.
Oh, really?
So thank you.
Yeah, that's Suzette is our ops manager over there.
Tony is?
No, Suzette oversees the GALs.
Tony Karajanis was my son's guardian at Lighterman.
Nice.
He was wonderful. So
Yeah.
thank you.
No, thank you. You know what it's like.
It's not an easy process.
No.
Not for the kids and definitely not for parents,
Right.
especially single parents.
Yeah.
It's not fun. Especially going through the trauma of watching the child be abused.
Right, exactly. And the kids, so.
Thank you, Madam Chair.
So I'm gonna say like Alder.
It's been a long night.
No, actually, no, it's what you just said, and Alderman Dente, it was you who made me just stop for a moment. We thank you for what you do, and you safeguarded 750. We would love for you to continue in existence, but hopefully, like you said,
Yeah.
we'll be in a better place. So thank you for coming and presenting, and we've got a lot of work to do. as we
Yeah,
go
I
forward.
know.
Thank you, so we
Yeah.
appreciate your time. Thank you. So our next presenter will be Mary Wade Home, David Hunter. Good evening.
Good evening. Alders, Madam Chair.
Name?
David Hunter, representing Mary Wade Home at 118 Clinton Ave. So I have two proposals, one the soft and one for the public facility request.
Page 82 is the first one.
Is that public, is that transportation?
What's the first one?
Yeah.
Yes. 82 is the first?
Public service.
Public service, go ahead, so we're gonna start. Sorry.
Transportation.
That's it. Hold on one second. Yes, thank you.
You're welcome, thank you. I hate to read, but I don't want to miss anything. Thank you, I appreciate that. Better actually on my feet, but we'll just get through this. Not on my feet at all.
Oh, okay, no
So,
worries.
this is a $25,000 request for portion of salaries for 4 drivers for our senior transportation. So our goal always with this program is to improve the access to safe transportation to medical appointments, dentists and doctors' offices during the week, socialization. And socialization on the weekends, to from grocery stores or services on Sundays for the folks. And the majority of our folks, well, all of us, plus years old, and many with physical and or cognitive disabilities. Over 70% of our clients are low, very low, and moderate income. They're not on Medicaid. These folks have transportation through the Medicaid system. These are for seniors in the New Haven who are not on Medicaid, who need transportation, don't have it. And we are New Haven's only donation-based wheelchair accessible accounts, and clients receive exceptional services regardless of their ability to contribute. So through the federal grant that helps us support this program, we're required to ask for contributions, not demand it, but ask for it. So I write letters to thank people for giving me a $2 donation for the transportation program, which we're happy with. The need here, there's a higher demand of requests for medical and social transport. 50% increase is expected with the increase of seniors in the New Haven area and our plans to open our adult day centers on weekends, Saturdays, and Sundays, which we closed during COVID and just kind of rebuilding. And with transportation to from clients' homes. Our annual senior transportation program is $350,000 annually. We leverage funds of $325,000 from Mary Wade Home and other grants. So, Mary Wade Home is celebrating this year its 160th year on the corner of Pines Avenue. And we're very honored to be located in Fairhaven. And this, over the next 10 to 15 years, we're expecting expecting up to 60% increase in people over 65 in our state. So, these kinds of programs, I think, are important now as well. So, do you have any questions on transportation?
Any questions on transportation?
Next one. So we're asking for a grant, a CDBG grant of $88,348. I'm not sure how that came up in my office, but this is to replace the 26,400 square feet of 15-year-old carpet in our skilled nursing center. So, and we're going to replace this with antimicrobial slip-resistant vinyl flooring. This will improve the safety and creating a more home-like, dignified environment for residents and families in our skilled nursing center. We expect this will impact 8,000 residents, families, and staff over the next 15 years. Mary Wade Home provides 407 skilled nursing care in New Haven. We have long-term care, residential care, and short-term rehabilitation. 75% of our residents receive Medicaid. This is low to very low income. Medicaid rate is about $100 a day less than what our costs are. And so this is very important for us to get funding from the CDBG grant for this project. We have our skilled nursing home, the nonprofit, 94-bed nursing home with strong nurse to resident ratios for patient and family-centered care for Medicaid population. So the need for this is infection control, fall risk, meeting stringent regulations. Plans to double capacity short-term rehab unit. More and more people are requiring short-term rehab, and so we expect to double the capacity over the next year and a half. While also meeting demands for our long-term care residents of big growth in our senior population. Total project cost is $353,000 in place for 10 years and leveraging $265,000 from Mary Wade grants.
Any questions from the committee members at this time?
No question. Just want to thank you for not just being a good neighbor, but for everything that you do for the residents.
Thank you.
Alder Dente?
I agree about the rise in senior population, but it's also one of our most vulnerable populations. I have a lot of seniors in my community, and a lot are aging out of their homes, and it just shows the importance of places like Mary Wade, and like Alder Miller said, we just can't say how important you are to the caregiving community. Not just what Mary Wade does, but your continued commitment to all of our community projects. So thank you.
Thank you.
Thank you, Alder. I want to thank you for the service that you provide throughout this whole New Haven and across New Haven. My former father-in-law, as a matter of fact, Mary Wade, he's not with us anymore, but we really appreciate the fact that you're not just faced for fair labor, but
of course.
Really appreciate that.
Thank you.
Thank you, Chair, and thank you for all that you do. And it's wonderful. I do want to ask, how many of the residents that you do house are New Haven residents?
Or what?
Are New Haven residents?
I can send it to you. Well, in the nursing home, all of them, generally, I think, probably 95% are from New Haven. And our main patients come out of Yale, Haven hospitals. We have very few people and mid-state, but that's it. Maybe the VA.
Thank you.
Yeah, the majority of our nursing home residents are New Haveners. A lot of Fairhavens.
A lot of former Alders.
Yeah, everybody comes through our doors.
It's wonderful work that you're doing. Thank you.
Thank you. You know, taking care of older people is not really one of the things that gets a high rating. Got a great team of people, professionals at Mary Wade, a great board, very well, and that was important. So, I think it's there.
So thank you for your presentation, and absolutely, we do thank you. We've all been in, many of us have been in that space, and you're 100% saying you're right, clear across New Haven State. You're based in Fairhaven, but you stretch your arms clear across the state. And we do thank you for what you do for what we call the aging population, but they have been happening, so we thank you, and you are definitely providing a great space. I've been in the building, so for that, and we've got a lot of work ahead of us.
Yes.
So thank you so much for your time.
Thanks for what you do.
Thank you, sir.
Thank you for the service.
Our next presenters will be Christian Community Action. I have Crossman. Repeat that? I had Crossman. Crossman, my apologies. Okay. Yeah, come on. Name and address for the record.
Yeah. So I'm Hannah Crosman. I'm the Arise Center Director at Christian Community Action, also resident and homeowner at 47 Dyer Street.
I'm Mary Terrell. I'm the data manager for CCA, and I live at 100 York Street.
So, we are asking on behalf of CCA to request $30,000 to expand and enhance employment services at Arise Center at 156 Davenport Ave and New Hope Housing Program 660 Winchester Ave through investments in new technology and a client data tracking system. Christian Community Action has served families, mostly people of color, facing homelessness for almost 60 years. I'll be 60 years next year. 4,000 families in New Haven have received emergency and supportive services on an annual basis from CCA. Our request is specifically for updated technology, computers, iPads, projector, to expand and improve our computer labs, allowing for more individuals to simultaneously access employment resources, enhance employment-based workshop delivery, and modernize the planning process. We're also requesting funding to implement specialized data tracking software to better monitor client progress and outcomes. Currently, our technology and data management systems are limited and outdated. Many of our computers in our labs are over 10 years old, and slower computers serve less clients due to wait times and complete tasks. It just takes a longer time. Additionally, updated computer labs will allow us to update and expand computer labs will allow us to apply real digital literacy skills essential for today's world. An agency-wide data management platform would significantly enhance our ability to plan, refine, and document each family and individual goals and achievements as CCA assists them along their journey from homelessness and poverty crisis to thrive. Other benefits include enhanced methods of tracking the effectiveness of CCA's training and education programs, improved staff efficiency, giving them more time to work with the families. Even with our limited technology capabilities now, we have seen how families have improved their skills and employability. Recently, one of our shelter clients was able to use a computer in their computer lab to complete online training in order to obtain a job. Another shelter client able to take community courses online and be able to gain better job prospects. The technology investments that we are requesting complements a trauma-informed, person-centered approach with practical tools that empower clients to take control of their employment journey. With the full request, we are able to make significant improvements more by removing barriers, expanding access, and enhancing the quality of every service we provide. Thank you.
Approximately how many families service per year?
So we have 4,000 families in the city of New Haven.
Any other? So I am also going to make a comment because you are, I visited Sylvan there when you guys are doing your programming, supporting individuals. And
in the city. And it's very well received by the Hill residents, what you do also for our children, because they're providing them, for parents that can't provide them the Christmas gift, they come in, do their little shopping, and you treat them with grace and dignity. As your food pantry, dynamic director, everybody, keeps us awake, and so I thank you for being in the community throughout the city again. Winchester Avenue, see that you guys are all, there's no borders across in New Haven because we're all one city, but we thank you for what you do with the fathers, with the mothers, and the children that you guys are producing. So again, this team has a lot of work ahead of them, but we thank you for the service that you provide, and know that we all appreciate you.
Thank you. I know working in the profit past and using like, thank you guys for doing this work you're doing.
Thank you. Thank you very much. We appreciate you. Thank you. Yeah, and thank you for the work you're all doing. Yeah, it's not an easy job to run this city, and I definitely appreciate it. Yeah, thank all the work it takes.
No, thank you so much. That's it. Okay. So we
I do have a question for you.
For,
Well,
yes, you have a question.
yeah, one question. Okay. Yeah, that's it. You could go ahead. Thank you. My coach and I have had a question. Where is the geographic location?
I just wondered if you could remind, thank you, Mr. Chair, you could remind us of what if any geographical, particular about the term.
We will look into it a little bit more, but what I'm thinking is as long as they are New Haven residents, they could be out of town, the agency. Yes, for New Haven.
So that would be a problem for this.
Correct. So they would have to separate what residents between New Haven and West Haven that they would be serving. Other funding sources for HUB is New Haven counties. So that's open-ended, but for CDBG specifically, it would have to be.
I don't know if this is
So for CDBG, it would have to be
New Haven residents.
Okay, CDBG grants. But it has to be
And they would have to, I don't even know. I don't.
Well, the agency would have to do that. They would have to check that.
Yeah.
And, West Haven does get CDBG funding as well. Yeah. So that's another option also.
I just want to clarify, so we have an organization from Florida that has it in office. And as long as they're serving New Haven residents, they could be registered.
Correct.
And that they provide the documentation needed for them to verify that they are servicing New Haven residents. So they have to keep a track and provide that information to you. Servicing.
Yeah, so they would keep that information at the agency. So in case it comes down and looks at it, we have been audited before, so they will get that information. So that will have the agency level open our information, and then verify that with their source documentation.
It would be also helpful to let them know that they need to report information. We need to report.
Right.
So be advisable to let them know that's part of our.
Yes, that's part of our application process.
Yeah, part of it is,
yeah,
to serve New Haven residents.
Yeah, they wouldn't even be at the table if they weren't.
No, we just want to make sure it's.
Yeah.
Thank you, thank you.
Yeah. Yeah, so they to a thing.
Information. Any questions for
Madam Chair, if I had a question about reprogramming, is there something should I ask?
Yes.
Hi, sorry, thank you, Madam Chair. I did have a question on reprogramming in page 63. I have a lot to learn, but there was just a discrepancy. But there was $1,000 in the program. That was, I just wanted to know what the process was and it became later on.
Yes,
I didn't see as much, that amount as much in the other operations.
Yeah, so exactly that's what happened. So originally when we had the mayor's proposed or the anticipated allocation, $40,000 was not included in reaching out to Gavin. Department, they were reaching out to see if the Gathering Haven was actually going to be able to use the money. It was still in transition. Now we figured out that they will not be using the money. So I always had to report it later.
So omit it?
What's that?
$40,000?
No, that we added. So you can allocate that additional, you can allocate that $40,000 to next year. Which is good. We don't have everything, if we want to fund something.
So that's important because that's what the conversation that we had understanding with you all, so that the committee members can, again, we can't stress enough what they may not be using that we can allocate for something else, and what they're receiving, so that then the extent of hands can a little further out if grants or, you know, any funding that we are unaware of, and that's in transition, and we're all going to be getting that, because I think that was an important piece that we would have a conversation for those who are getting.
And then related to this also, there is a timeliness requirement. So we cannot, which is coming up, they do that timeliness test on May 2nd. So we cannot have more than 1.5 times our award actually in part of our letter of credit. So it has to be out of that time. They call it LOCKS, the credit control system. So it has to actually be drawn down. And we've run into issues before pretty close to not making that timeliness, especially during COVID, when things were very slow. We did get reimbursed for it. It wasn't just New Haven, it was everyone. This year, we just did this estimate about 1.1 times our allocation, so that's good. We have to have less than 1.5, so we're fine. But that's another reason why we want agencies to move and have these projects ready. You know, not necessarily have to give it now. It's going to be a 2-year project. We want you to come, we want you to come when you're ready, and you need $40,000 to make the project.
Madam Chair, clarification. So on the admin applications, it looks like the total ask was $856,300. And does that come out of the total numbers, which would be about 14.5% of the $8 million?
So if you go to page 62, you can see those amounts under CDBG. You'll see public service, and we estimated 680. The actual amount will be 670. So that is, there's 3 separate categories. So we'll have 2.8 for hardware, 5.9 for public service software, and 671 for admin. So that is the amount already. That's part of the allocation.
Okay, great. Thank you for the clarification. I also just want to say, for overhead, that's really great for the amount of industry work you are doing to support these grants. It like beats every industry standard. So thank you. Thank you.
So I think that one of the things I'm going to recommend that way we get all state platform, and that it's clear. Our going to ask this team absolutely I think it would be beneficial if we're all included in this whole team, so that if we need to ask questions and put the questions on there and include us all, that way we're all aware of what I'm asking and what you're answering, and we know exactly what you're all looking at and what they, so that would be for us. Yes, yeah.
I love transparency.
Yes, so
do we.
So we appreciate it, seriously, and again, they, how many years did this? No, I thank you, for your certificate, I can, our things are going on. I want to, we're meeting. Yes, we're put in a proposal, but that's not set in stone. That's what we're here for, so that we can assist. We're gonna have our input, and that's what.
I'd like to add, you share all questions from the colleagues directed to the chair, to the chair.
Yes, that's much better than just from the chairs.
Okay. I mean, review the book, any questions, and then we will come together again, and our representatives will be,
May 20th. May 20th.
okay, that'll be a little bit longer. That's, we're ready.
Are we marking
Our
calendars, May
apologies.
20th will be our next meeting?
Yes.
So we have a long time between the next one and then short between deliberation.
28th.
Yeah.
You all, again, thank you.
Thank you.
You're part of the extended team now.
I appreciate what you guys do. We appreciate it. We appreciate it. Thank you, guys. Okay.
Good, right.
Close the public portion. No public portion?
Thank you. Yes. Budget team.
Motion?
You can make a motion?
Adjourn, Madam Chair.
Can I hear a second? The motion has been made and seconded. All those in favor?
Aye.
Any opposed? The ayes have it. We adjourn.
Oh, God, that's capital.